At the time of my event, I was struck by the enormous hole in the system around emotional support on the patient and family side, as well as the clinicians. And when you're fortunate enough to survive an incident like this, for me, I felt a real sense of shame on me if I didn't do something about it. And that's why MITSS was formed.
So often in planning how we're going to improve healthcare, we don't think about engaging the patients. This organization is an exception.
MITSS has been a real game changer in the patient safety movement in being an advocate not only for the patient and their families who have experienced an adverse event, but for the providers as well. And that educational and outreach activity that MITSS has been engaged in has helped so many colleagues in the medical profession and so many patients and their families. It's really been a lifesaver for them.
MITSS and the whole group of people who continue to support patients through this, and clinicians, is they show you that we as humans can be resilient. We can go down so low and feel so bad, and all with just support. And what's support? Support is kind words. Support is a listening ear. And that's the gift that I feel MITSS gave me during my hardest of times, was there was somebody to listen, someone to say, I do know how you feel. And that's so much needed when you're going through an event like this.
I was so lucky to get that communication, to get that apology, and to get that willingness to just have a conversation.
So 15 years ago, when my son Noah died from medical error, the only person at the hospital who contacted us was the surgeon who was involved in the error. He listened to me rant and rave and expressed quite a bit of anger and frustration to him. And afterwards, as I started understanding errors and understanding the need to improve quality in healthcare, I started to wonder how the impact on him and the care that he gave to subsequent patients, after listening to me call him a murderer and call him many other names that I don't want to say right now. I think MITSS brings patients and families together with clinicians, all who have been hurt by whatever error or adverse event has happened. And I think that is the key to improving quality and making patients safer.
When one person makes it their mission to be heard, really great things can change and come as a result of that. So our hope is that with a shared understanding, complete and honest transparency, we can nurture a newly trusted relationship with our patients.
Focusing on patient care, where accidents happen, and on the patient level, when something does happen, to be your own advocate.
Definitely people-centered, and it's people. It's not just patient. It's not just a clinician. It's not just a doctor. It's everybody. I mean, everybody's human. People are going to make mistakes. And they acknowledge that they're very real, and they've also recognized the need that when something does go wrong, it doesn't just go wrong for the patient, but also the clinicians too.
Teaching patients to push for the answers that you need and getting the care that you deserve.
I recently became the board chair of MITSS, and I have worked with Linda over many years, and I've also worked in patient safety for many years, and one of the things I think that you realize over time is how the environment can be so harsh, both for patients and families and for clinicians, and that anything that you can do to lighten the load for people or support them so they're not worrying alone in the current environment would be helpful for patients and families as well as for clinicians.
We support the work of the many dedicated and talented people that work already within our healthcare system, who can inspire those changes and are committed to doing so.
I think one of the most encouraging thing about the patient safety movement, and something we need to think about when we get discouraged, is the success we've had in attracting people of outstanding talent and abilities to our field.
So years ago, I will tell you that nobody listened and nobody wanted to hear. But they hear me now.
In this state and nationally, as we re-engineer our healthcare system, I certainly hope, and I'm sure you all hope, that we re-engineer in more of the things that MITSS stands for. Dignity and respect for our patients, for their families, and for our caregivers.
If we can ease the fears and traumatization on one side, then we can ease it on the other. MITSS has been dedicated to reaching across that chasm. We would all do well to take their tools and their lessons and apply them to everything we do every day.
Or I think they're just real pioneers in the approach that they've taken with their work and
A new perspective.
they're a front runner. There's not many other organizations that I can think of that is this unique.
I think MITSS is the only organization that is really dedicated to both sides. So it's sort of remarkable looking back over the last 10 years to see the kind of enthusiasm you've managed to drum up.
Our first dinner was at my husband's restaurant, and we had 75 friends and family. There was one person from the healthcare community, which we now know was Rick Van Pelt.
So medicine is a healing art. It should never be adversarial, but always rather about the willingness to learn and show that you care, because really care is all that matters.
What I admire so much about the mission of MITSS is to care for both clinicians and patients and families when things don't go well. So thank you for everything.